Shockwave therapy is one of the latest treatment modalities for erectile dysfunction. This pain-free and pill-free treatment is perfectly suitable for them who want to avoid the unnecessary side effects of the available medicines. In the penis, these shock waves cause mild damage to old blood vessels and break plaques like cholesterol from blocked blood vessels. It reduces the oxygen supply to penis and cause increase in new blood vessel formation. Because of these combined actions, the penis get new improved blood supply and this cures erectile dysfunction in men. Shockwave therapy is one of the many treatment options for erectile dysfunction, but you should know that it is not FDA approved. However, the science behind this pill-free treatment has been supported by several studies and that have shown encouraging results. Shockwave therapy appears to work best for men with vasculogenic erectile dysfunction, which is a blood vessel disorder that affects blood flow to the tissue in the penis. If the erectile dysfunction is due to other causes, then it would not be helpful. Now let's see what is shockwave therapy. It's a non-invasive therapy that has been used in orthopedics for years to help heal broken bones, injured ligaments, and injured tendons. The clinical term for this shockwave therapy is low-intensity shockwave therapy. It uses targeted high-energy sound waves which can speed up the tissue repair and cell growth. Healthy blood flow to the penile tissue is needed for successful erection. Shockwave therapy can repair and strengthen blood vessels in the penis and improve blood flow. If we take medicines like sildenafil, tadalafil, it works the same way. However, those medicines have multiple side effects. Now let's see how this shockwave therapy works. Shockwave therapy is administered with a wand-like device placed near different areas of your penis. A healthcare provider moves the device along parts of your penis for about 15 minutes while it emits gentle pulses. As it is a painless procedure, no anesthesia is needed. The pulses trigger improved blood flow and tissue remodeling in the penis. Both of these changes can lead to erection, which is sufficient for sex. There is currently no established recommendation for treatment period or frequency. Most common treatment plan was twice weekly for 3 weeks, followed by a 3 weeks without treatment and another 3 weeks of twice weekly treatment. The analysis found that the effects of shockwave therapy lasted about a year. Now let's discuss about the side effects. Currently there is no established side effects. More research needs to be done to determine the side effects, complications, and long-term effectiveness. However, very rarely people found mild pain at the site of the procedure and bruising around the penis. But again, it is very rare. So that's all about the shockwave therapy. I hope you find this video helpful. Don't forget to like, comment, and subscribe. Thank you.
Does sex protect men against prostate cancer? What do you think? Evidence suggests that ejaculation frequency may be inversely related to the risk of prostate cancer. An observational study was conducted on 31,925 men with a 18 years follow-up, and the result was interesting. It is seen that men who ejaculate often may have lower risk of prostate cancer than their peers who don't do it as frequently. Researchers followed about 31,925 men starting in 1992, when they were in their 20s and continuing through 2010. During this period, almost 4,000 of the men were diagnosed with prostate cancer. The study found that men who ejaculated at least 21 times a month in their 20s were 19% less likely to be diagnosed with prostate cancer than men who ejaculated no more than 7 times a month. Men who ejaculated more often in their 40s were 22% less likely to get a prostate cancer diagnosis. Although this is an observational study and more studies will be needed to understand the potential biological mechanism underlying the observation. However, it is advisable to stay sexually active, especially over the age of 40. Studies are ongoing, but some experts theorize that ejaculation clears the body of toxin and other substances that could cause inflammation and increase the chances of having prostate cancer. Other important measures you can take to reduce the chances of prostate cancer, like eating more fruits and vegetables like tomatoes, green leafy vegetables, cruciferous vegetables like broccoli and cauliflower, and also soy food. Reduce trans and saturated fat intake. Green tea can also help to reduce prostate-specific antigen level, so you can try green tea on a regular basis. Take sufficient amount of vitamin D, maintain a healthy weight, get regular exercise, and stop smoking. That will help you to reduce the risk of having prostate cancer. We'll make a detailed video on the topic, how to prevent prostate cancer. We have already made a video on warning signs of prostate cancer. Click the I button on the upper right corner of your screen to watch it. That's all for today. Hope you like this video. Don't forget to like, comment and share. And don't forget to subscribe also. Thank you.
Morning erection or morning wood is a very common phenomena in men. Formerly, it was known as nocturnal penile tumescence. This occurs when someone with penis gets an erection in the middle of the night or the early morning hours while they are still sleeping. Now the question is it good or bad? Before jumping into the conclusion, let's discuss why does morning wood happen. The cause of morning erection is likely dependent on many possible factors. One of the common factors is our parasympathetic nervous system. This part of the nervous system controls many of the things that happen in our body, like digestion, urination, and sexual arousal. When you are in sleep, your parasympathetic system dominates. It happens especially in the REM sleep stage. There are mainly 4 stages of sleep. REM is the sleep stage in which you dream. Most people wake up after or during the REM stage of sleep, which means you're more likely to wake up while you have an erection. You may actually get more than one erection each night, but you tend to notice them mostly when you're closer to waking up in the morning. Few experts believe that the sacral nerve may play a role in the morning erection. When your bladder is full, it may press on the sacral nerve, leading to an activation of the parasympathetic nervous system, which can then lead to an erection. Hormonal changes might be another important cause of morning wood. Your testosterone level is at its highest in the morning after you wake up. It is highest immediately after waking up from the REM sleep stage. The increase in this hormone alone may be enough to cause an erection, even in the absence of any physical stimulation. Next important reason is brain relaxation. During your working hours, your body releases hormone to suppress erections. So when you're asleep, your body releases less of those hormones. Combine this with other reasons you may experience an erection in your sleep, and nocturnal penile tumescence becomes more likely. Another common reason is physical stimulation. Though your eyes are shut, your body is still aware of what's happening around you. If you or your partner accidentally touch your genitals, it may become erect. Your body senses the stimulation and responds with an erection. So in short, morning erection is completely a natural and a healthy thing. It is a sign of a properly functioning blood and nervous system in and around the penis. Men of all ages can experience morning erection, but it may become less common as you get older. Now, if you suddenly stop experiencing this or notice that you're not waking up with an erect penis anymore, then this may be an early sign of an underlying medical problem. Most likely, this is a sign of physical erectile dysfunction, and you should check for high blood sugar, high blood pressure, and high cholesterol level. Remember that painkillers and some antidepressant medications may also prevent morning erection. So when to see a doctor? If you're facing a sudden drop in frequency of having morning erection, then it's better to consult a doctor. Another important condition is having painful erection. Most morning erections will subside within 30 minutes of waking up. If your erections last more than an hour after you wake up, or if they become painful, then you should definitely make an appointment with a doctor. Alright, that's all for today. Hope you find this video helpful. Don't forget to like, share and subscribe to our channel. Thank you. Healthy sperms aren't always given. Sometimes you need to put some effort into increasing your sperm count and overall quality improvement. So let's talk about how to increase sperm count and how to improve sperm quality. Your chance of getting your partner pregnant decreases with decreasing sperm count. Some men have no sperm in their semen at all. This condition is known as azoospermia. Normal sperm count ranges from 15 million to greater than 200 million sperm per milliliter of semen. You are considered to have low sperm count if you have fewer than 15 million sperm per milliliter or less than 39 million sperm total per ejaculation. Now, before going to the discussion, you should know that only one healthy sperm is needed among the billions of sperm to get pregnant. Some men with low sperm counts successfully father children. And likewise, some men with normal sperm counts are unable to father children. Even if you have enough sperm, other factors are important to achieve pregnancy, including normal sperm movement or motility and overall sperm health. Now let's see how to improve sperm count and sperm health. Zinc plays very important role in male fertility. Observational studies show that low zinc status or deficiency is associated with low testosterone levels, poor sperm quality, and an increased risk of male infertility. Taking zinc supplements also increases testosterone levels and sperm count in those who have low level of zinc. Zinc is an essential mineral found in high amounts in animal foods such as meat, fish, eggs, and shellfish. Legumes like chickpeas, lentils, and beans all contain substantial amounts of zinc. You can also add squash, pumpkin, hemp, and sesame seeds in your diet. Next thing is very important, that is regular exercising. There is no better alternative than daily moderate exercise. Studies have shown that men who exercise regularly have higher testosterone levels and better semen quality than inactive men. But one should also avoid too much exercise as it may have an opposite effect and potentially reduce testosterone levels. Next thing you can consider is D-aspartic acid supplements. It may increase testosterone levels and sperm count. A study in infertile men suggested that taking 2.7 grams of D-aspartic acid for 3 months increased their testosterone levels by 30 to 60% and sperm count and motility by 60 to 100%. However, more research is needed to investigate the potential long-term risk and benefits of D-aspartic acid supplements in humans. Next important thing is getting enough vitamin C. Vitamin C is an antioxidant. It reduces the oxidative stress in our body. In simple words, it reduces the harmful toxic chemicals in our body. So this process is very important for sperm health and sperm quality. A study in infertile men showed that taking 1000 mg vitamin C supplements twice a day for up to 2 months increased the sperm motility by 92% and sperm count more than 100%. It also reduced the proportion of deformed sperm cells by 55%. Vitamin C supplements also significantly improve sperm count and motility. Sperms can be especially vulnerable to environmental factors such as exposure to excessive heat or toxic chemicals. That's why it is advisable not to smoke. Men who smoke cigarettes are more likely to have low sperm counts. Also, limit your alcohol consumption. Moderate amount of alcohol is okay, but heavy drinking can lead to reduced testosterone production, causing impotence and decreased sperm production. Tribulus terrestris, also known as puncture vein, is a medicinal herb frequently used to enhance male fertility. Basically, it does not raise testosterone levels, but research indicates that it enhances the libido-promoting effects of testosterone. So that's how it is helpful for erectile dysfunction. Fenugreek, also known as methi, helps in increasing testosterone level, sperm count, frequency of sexual activity, and improve erectile dysfunction. Several observational studies strongly support these benefits. But keep in mind that all these studies have fenugreek extracts, So it's unlikely that the whole fenugreek which is used in cooking and herbal tea will have the same effect. You can also consider ashwagandha. It is a medicinal herb that's been used in India since ancient times. Studies suggest that ashwagandha may improve sperm counts, sperm motility, antioxidant status, and testosterone levels. One study in men with low sperm cell counts showed that taking 675 mg of ashwagandha root extract per day for 3 months increased sperm counts by 167%, semen volume by 53%, and sperm motility by 57%. Vitamin D is also important for male and female fertility. It helps in boosting testosterone levels. Taking 3000 international units of vitamin D3 every day for 1 year may increase testosterone levels by around 25%. It also improves sperm motility. A few studies indicate that low intake of folate may impair semen quality. So make sure that you are taking sufficient amount of folate, vitamin D, and vitamin C. Now last but not the least, manage your stress, sleep well, and eat a healthy diet and exercise daily. It will improve the overall scenario. I would also like to mention that don't be judgmental about semen volume. Only 5% of the semen is made up of sperm. We will make a detailed video about sperm analysis as well. Hope you find this video informative. If you liked our video, don't forget to like, share, and subscribe to our channel. Thank you. Tadalafil is a phosphodiesterase inhibitor which is used for the treatment of erectile dysfunction. It is also commonly known under the brand name Cialis. This medicine is also used to treat symptoms of benign prostatic hyperplasia or an enlarged prostate. Tadalafil is used to improve the ability to exercise in people with pulmonary arterial hypertension. It works by increasing blood flow into the spongy erectile tissue of the penis that consequently allows it to grow in size and become erect and rigid. Now, how to use this medication? First and foremost thing, consult your doctor before taking this medicine because there is rare but severe side effects and drug interactions with other medicines. To treat erectile dysfunction, take this drug by mouth as directed by your doctor. You can take this medicine with or without food. Take tadalafil at least 30 minutes before sexual activity, but remember, do not take more than once daily. Tadalafil is also sometimes taken once daily every day, irrespective of your sexual activity timing. You may attempt sexual activity at any time between the doses. If you are taking tadalafil on a regular schedule, then take it around the same time every day. Now, the first thing that you should remember is to not take this medication without doctor's prescription, especially when you are taking medicine for heart disease. Taking tadalafil with nitrate medicine can suddenly and severely decrease your blood pressure. It is usually taken 30 minutes to 1 hour before sexual activity. There are many side effects like chest pain, blood pressure changes, stomach ulcer, liver, or kidney problems. Also, here are the 2 things you should remember if you are taking tadalafil because these 2 problems need immediate medical attention. First thing, if your erection is painful or lasts longer than 4 hours, which is called as priapism in medical term, it can damage the penis. It is very rare and painful condition where blood gets trapped in the penis and is unable to drain through penile vessels. Now, what to do in that situation? You can apply ice packs on the penis and perineum. If the priapism is non-ischemic in nature, there is a chance that it will go away. However, most of the time it is ischemic in nature and the pain worsens with time. So in that situation, immediately visit or consult your doctor. Now next is if you have vision loss. Seek immediate medical attention if you face this type of problem. Also, if you are a heavy drinker, then you should make a note of this point. If you like a glass of wine or any other alcoholic beverages, then there shouldn't be any problem. But drinking more than that after taking Cialis could hamper your activity. Moderate to heavy drinking can make it harder for you to get an erection. Also, Cialis and alcohol both acts as a vasodilator. Vasodilators are substances that lower your blood pressure by relaxing the walls of your blood vessels, which then allow the blood vessels to open wider. Drinking too much alcohol while taking Cialis can lead to orthostatic hypotension. This can cause a headache, dizziness, and fainting, which can cause fractures or other injuries. Now let's talk about some other medications which can interact with tadalafil. If you're also taking an alpha blocker medication such as doxazosin, tamsuline to treat an enlarged prostate or high blood pressure, your blood pressure may get too low, which can lead to dizziness or fainting. Some other antifungal, antibiotic and antiviral medications can also interact with tadalafil. So consult your doctor before taking tadalafil if you're already on any other medications. Now here are some conditions when you should strictly avoid this medicine. If you have a previous history of allergy by taking this medicine, then you should not take it again. If you have a history of painful erection, then strictly avoid it. There are other conditions where you should avoid this medicine like multiple myeloma, leukemia, sickle cell anemia, pigmentary retinopathy, hearing loss, significant uncontrolled high blood pressure, a heart attack, a sudden worsening of heart-related chest pain which is called angina, narrowing of aortic heart valve, hypertrophic cardiomyopathy, life-threatening irregular heart rhythm, chronic heart failure, a stroke, low blood pressure, liver problems, severe renal impairment, and Peyronie's disease and many other conditions. Now let's talk about the dosage. The daily dose is different for erectile dysfunction, benign prostatic enlargement, and pulmonary hypertension. The usual dose for ED is 10 mg once a day, but never take 2 tablets at a time. The usual dose for prostate enlargement is 5 mg once a day, and for pulmonary hypertension it is 40 mg. Tadalafil tablets for pulmonary hypertension come in 20 mg strength. So you will have to take 2 tablets at a time once a day. But remember, this dose can vary according to the severity and health conditions. So always consult your doctor before taking the medicine. Also, we have already made a video about sildenafil. Click the I button on the upper right corner of your screen to watch it. So that's all for today. Hope you liked our video. Don't forget to like, share and subscribe to our channel. Thank you. Viagra and Cialis belong to the same class of medications called phosphodiesterase inhibitors. These drugs work by blocking the PDE5 enzyme. Both are oral medications used to treat erectile dysfunction, but there are some basic differences that you should know before taking them. In this video, we are going to compare these two medications side by side and we'll see which one is suitable for you. The generic name of Viagra is sildenafil and the generic name of Cialis is tadalafil. They boost a chemical in your body called nitric oxide which encourages the muscles in your penis to relax. Now relaxed muscles allow blood to flow freely so you can get an erection when you're aroused. It also helps you maintain the erection long enough to have sex. Unlike Viagra, Cialis is also used to treat enlarged prostate and pulmonary hypertension. So Cialis has a broader spectrum of use than Viagra. Now let's talk about the dose and timing of the medicines. Viagra comes in a strength of 25, 50 and 100 mg, while Cialis is available in low strength of 2.5, 5, 10 and 20 mg. Now that means you can take smaller dose of Cialis every day according to your prescription, but this is not same for Viagra. Cialis is usually taken 30 minutes before sexual activity, while Viagra can be taken 30 to 60 minutes before the activity. Now one of the most important things that you should know is that Cialis is not affected by your meal or food intake. That means you can take Cialis with or without food. On the contrary, a high-fat meal can delay the action of Viagra. So take your medications accordingly. Next important point is the duration of action. Viagra usually lasts for about 4 hours. However, Cialis lasts much longer and it's noteworthy for the amount of time it remains in your body. You may feel the effects of the drug up to 36 hours after you take it. Now let's see if there is any difference in side effects. The side effects of both medicines are almost the same as they both can cause nausea, headache, generalized muscle pain, back pain and flushing. However, side effects like indigestion and limb pain is specifically seen in Cialis and Viagra can cause vision change, rash and dizziness. Now the drug interactions with other medicines are almost the same. There is no significant difference. Now the final question is which one is better? According to systemic review and meta-analysis published on NIH, tadalafil and sildenafil have both shown to exhibit comparable efficacy, safety and satisfaction for the treatment of erectile dysfunction. But if you compare in terms of psychological outcome, tadalafil appears to be better. The side effects are also less with tadalafil and you don't have to worry about the food intake. Therefore, tadalafil may be a better choice for erectile dysfunction treatment. However, it's not always a good idea to take medicines full of side effects and future complications. There are many other ways you can improve your erection and live a healthy life. We have already made a video on that topic as well. Click the I button on the upper right corner of your screen to watch that video. Alright, that's all for today. Hope you liked our video. Don't forget to like, share and subscribe to our channel. Thank you. Tadalafil is a phosphodiesterase inhibitor which is used for the treatment of erectile dysfunction. It is also commonly known under the brand name Cialis. This medicine is also used to treat symptoms of benign prostatic hyperplasia or an enlarged prostate. Tadalafil is used to improve the ability to exercise in people with pulmonary arterial hypertension. It works by increasing blood flow into the spongy erectile tissue of the penis that consequently allows it to grow in size and become erect and rigid. Now, how to use this medication? First and foremost thing, consult your doctor before taking this medicine because there is rare but severe side effects and drug interactions with other medicines. To treat erectile dysfunction, take this drug by mouth as directed by your doctor. You can take this medicine with or without food. Take tadalafil at least 30 minutes before sexual activity, but remember, do not take more than once daily. Tadalafil is also sometimes taken once daily every day, irrespective of your sexual activity timing. You may attempt sexual activity at any time between the doses. If you are taking tadalafil on a regular schedule, then take it around the same time every day. Now, the first thing that you should remember is to not take this medication without doctor's prescription, especially when you are taking medicine for heart disease. Taking tadalafil with nitrate medicine can suddenly and severely decrease your blood pressure. It is usually taken 30 minutes to 1 hour before sexual activity. There are many side effects like chest pain, blood pressure changes, stomach ulcer, liver or kidney problems. Also, here are the 2 things you should remember if you are taking tadalafil because these 2 problems need immediate medical attention. First thing, if your erection is painful or lasts longer than 4 hours, which is called as priapism in medical term, it can damage the penis. It is very rare and painful condition where blood gets trapped in the penis and is unable to drain through penile vessels. Now, what to do in that situation? You can apply ice packs on the penis and perineum. If the priapism is non-ischemic in nature, there is a chance that it will go away. However, most of the time it is ischemic in nature and the pain worsens with time. So in that situation, immediately visit or consult your doctor. Now next is if you have vision loss. Seek immediate medical attention if you face this type of problem. Also, if you are a heavy drinker, then you should make a note of this point. If you like a glass of wine or any other alcoholic beverages, then there shouldn't be any problem. But drinking more than that after taking Cialis could hamper your activity. Moderate to heavy drinking can make it harder for you to get an erection. Also, Cialis and alcohol both acts as a vasodilator. Vasodilators are substances that lower your blood pressure by relaxing the walls of your blood vessels, which then allow the blood vessels to open wider. Drinking too much alcohol while taking Cialis can lead to orthostatic hypotension. This can cause a headache, dizziness, and fainting, which can cause fractures or other injuries. Now let's talk about some other medications which can interact with tadalafil. If you're also taking an alpha blocker medication such as doxazosin, tamsuline to treat an enlarged prostate or high blood pressure, your blood pressure may get too low, which can lead to dizziness or fainting. Some other antifungal, antibiotic, and antiviral medications can also interact with tadalafil. So consult your doctor before taking tadalafil if you're already on any other medications. Now here are some conditions when you should strictly avoid this medicine. If you have a previous history of allergy by taking this medicine, then you should not take it again. If you have a history of painful erection, then strictly avoid it. There are other conditions where you should avoid this medicine like multiple myeloma, leukemia, sickle cell anemia, pigmentary retinopathy, hearing loss, significant uncontrolled high blood pressure, a heart attack, a sudden worsening of heart-related chest pain which is called angina, narrowing of aortic heart valve, hypertrophic cardiomyopathy, life-threatening irregular heart rhythm, chronic heart failure, a stroke, low blood pressure, liver problems, severe renal impairment, and Peyronie's disease and many other conditions. Now let's talk about the dosage. The daily dose is different for erectile dysfunction, benign prostatic enlargement, and pulmonary hypertension. The usual dose for ED is 10 mg once a day. But never take 2 tablets at a time. The usual dose for prostate enlargement is 5 mg once a day, and for pulmonary hypertension it is 40 mg. Tadalafil tablets for pulmonary hypertension come in 20 mg strength. So you will have to take 2 tablets at a time once a day. But remember, this dose can vary according to the severity and health conditions. So always consult your doctor before taking the medicine. Also, we have already made a video about sildenafil. Click the I button on the upper right corner of your screen to watch it. So that's all for today. Hope you liked our video. Don't forget to like, share and subscribe to our channel. Thank you. Can vitamins like folic acid actually improve erection? What do you think? Folic acid is an essential vitamin for our health. It is especially beneficial in pregnancy. Getting enough folate during pregnancy is particularly important as it is crucial for early fetal development, particularly with regard to the spinal cord. It also helps the body make healthy new red blood cells. But how is it going to help in erectile dysfunction? The researchers found that men with erectile dysfunction typically had lower levels of folic acid than the healthy and unaffected men. Now, interestingly, low levels of folic acid were also associated with premature ejaculation. Now, another important thing is homocysteine. It is an amino acid. A high level of homocysteine in our body is responsible for cardiovascular disease and the endothelial damage. Now, the endothelial cells are the main type of cells found in the inside lining of blood vessels. They are the main source of nitric oxide in our body. Now, the increase in homocysteine level damages the endothelial lining and decreases the production of nitric oxide. As we have previously discussed, nitric oxide is very important for successful erection. Low level of folic acid in our blood is responsible for high levels of homocysteine. So, taking folic acid or folate can reduce the homocysteine level and fix the erection problem. Previously, multiple studies had been conducted on that topic. However, the result was inconclusive. Some studies showed a direct relation between folic acid deficiency and erectile dysfunction. But some studies showed there is no relation. A recent meta-analysis of 6 studies compared 982 men with erectile dysfunction and 862 healthy men without erectile dysfunction. They showed a direct correlation between low level of folic acid and severity of erectile dysfunction. Lower the level of folic acid, higher the severity of erectile dysfunction. Now, in this study, men with erectile dysfunction showed measurable improvements in erectile health after taking folic acid supplements on a daily basis for 3 months. Another study was conducted on 83 patients with type 2 diabetes and erectile dysfunction. They were randomly divided in 2 groups. Group A was treated with tadalafil 10 mg every other day plus folic acid 5 mg daily, whereas Group B received tadalafil 10 mg every other day with placebo pills daily for 3 months. They have shown a significant improvement in patients who have taken both tadalafil and folic acid. So, should you start taking a folic acid supplement? Well, currently there is no standard guideline to take folic acid supplements, and also there are certain medications which shouldn't be taken with folic acid like anti-seizure medicines, barbiturates and some cancer medicines. So, it is better to consult with a healthcare professional or go for a natural options. Folic acid found in wide range of foods include green leafy vegetables like broccoli, spinach, asparagus and lettuce, meats including liver, peanuts, sunflower seeds and beans, seafood, eggs, milk and other dairy products. Folic acid is also commonly added to many breads, cereals, pastas, and other grain products in order to prevent deficiencies. But the best way to prevent erectile dysfunction is to manage your stress, sleep well, eat a healthy diet, and exercise daily. This will certainly improve the overall scenario. Alright, that's all for today. Don't forget to like, share, and subscribe our channel. Thank you. Have you ever noticed that you think you're suffering from erectile dysfunction and still having a morning erection? Erectile dysfunction is not always a disease that you should be concerned about. We are continuously talking about how to manage the situation. Taking pills with full of side effects is not always a good idea. This is just a temporary solution. So what if we can fix it permanently? To cherish this idea, we have to understand the mechanism of erection first. One of the most important molecules involved in erectile dysfunction is nitric oxide. Most of the ED medicines use nitric oxide pathway. So why this is important? What is the function of nitric oxide in our body? Well, nitric oxide relaxes the smooth muscle of our blood vessels, which helps to improve blood flow. It is not only beneficial for erectile dysfunction, but it is also helpful for our heart and overall body function. Nitric oxide also helps you make testosterone and is also involved in the hormone that controls the amount of testosterone your body makes. Testosterone is important for healthy erection. Nitric oxide also regulates our stress hormone cortisol and helps to improve sleep. Stress is one of the common underlying cause of erectile dysfunction. There are two systems working together in our body. One is sympathetic system and the other one is parasympathetic system. For a healthy erection, your parasympathetic system should be activated. But when you are in stress, your sympathetic system primarily dominates. In the beginning, we spoke about morning erection. In the morning, when you are in sleep, the stress hormone level is low and your parasympathetic system is dominated. So if you are suffering from erectile dysfunction and you have normal morning erection, then the problem could be the stress. If you could reduce the stress, the problem of erection will automatically reduce. Nitric oxide is also involved in your sleep cycles. A sleeping problem like sleep apnea increases your risk of erectile dysfunction. Diabetic patients are more prone to erectile dysfunction. This is because of the destruction of endothelial cells present inside your blood vessels. These endothelial cells are the main source of nitric oxide in your body. On the other hand, nitric oxide increases insulin sensitivity, which is essential to control diabetes. Also remember, some lipid-lowering drugs like statin and fibrates can also cause erectile dysfunction. So nitric oxide is the main key here. If we can increase nitric oxide level in our body, it will solve the erection-related problem significantly. Normally, nitric oxide reduces by 50% after 40s. So is there any way to boost nitric oxide level in our body? The answer is yes. First thing you should do is practice nasal breathing. Nitric oxide is produced in paranasal sinuses and is excreted continuously into the nasal airways of humans. When we breathe through our nose, this nitric oxide reaches the lung and circulates all over the body. Now the next thing you should do is regular exercise. There are several benefits of regular exercise. It helps to reduce our stress, which is very important to treat erectile dysfunction. It can also improve your vascular system, endothelial cells, and increase nitric oxide secretion. So regular exercise is the key for healthy erection. Now let's discuss about some foods which are high in nitrates. Spinach is not just a great addition to salads, but also a great source of natural dietary nitrates. A 100-gram serving of fresh spinach contains anywhere from 24 to 387 mg of nitrates. This amount varies widely depending on growing conditions. Out of cabbage family, bok choy is the highest in nitrates. Depending on its growing condition, bok choy can contain anywhere from 103 to 309 mg of nitrates per 100 gram. Next is lettuce. While lettuce isn't always known for being rich in nutrients, it contains a significant amount of natural nitrates. It has 13 to 267 mg of nitrates per 100 gram servings. Then there are beets. Beets are rich in dietary nitrates, which your body can convert to nitric oxide. According to one study in 38 adults, consuming a beetroot juice supplement increased nitric oxide levels by 21% just after 45 minutes. Next are carrots. If you are looking for slightly earthier alternative, then carrots contain anywhere from 92 to 195 mg of nitrates per 100 gram. Now the other foods that you can consider are garlic, meat, dark chocolate, citrus fruit, pomegranate, nuts, seeds, and watermelon. Now the next thing is to avoid sugar, alcohol, and stress. Sugar increases the chances of having atherosclerotic plaque and can damage the endothelial lining of our blood vessels. So more the damage of endothelial lining, less the amount of nitric oxide in our body. Alcohol also reduces the level of nitric oxide in our body. And earlier we have already discussed about the stress and how it affects our body. Now the next thing you should improve is your sleep. A good sleep can reduce stress and improve erection. Also, one important point you should remember that many drugs can cause temporary erection problem. So talk to your doctor if you are taking any medicine and are experiencing any recent changes in your erection. We have already made a detailed video on erectile dysfunction. Check the video for more information. So alright, that's all for today. Hope you find this video informative. Don't forget to like, share and subscribe to our channel. Thank you.